Hello, everyone. Good morning, good afternoon, and welcome. We are thrilled to have you join us today for what promises to be a truly energizing and needed conversation about how innovation in social protection systems can help drive food systems transformation. Before getting started, I want to highlight that the socialprotection.org team is running a survey to better understand the needs and the preferences of valued users just like you all. So if you have a few minutes, I encourage you all to fill out this survey. Today's event is titled Breaking the Mold, Unlocking the Innovation Potential of Social Protection to Drive Food Systems Transformation. I'm Anthony Wendt, the Social Protection Lead at the Global Alliance for Improved Nutrition, or GAIN, and I'm joined by Dr. Lawrence Haddad, GAIN's Executive Director, who will be moderating the panel discussion portion of this webinar. GAIN is thrilled to co-host this webinar with our partners at the World Food Program. This event is part of the ongoing policy dialogue series put on by the UN Food Systems Summit Coalition and USP 2030 Working Group on Social Protection and Food Systems. Our coalition was established to understand the roles that social protection can play in food systems transformation and to amplify the various linkages that connect social protection and food systems. Today, we will closely examine one pathway to make social protection a better tool for reaching food systems goals: innovation. Our coalition maintains that social protection is a critical driver of food systems transformation. And in today's webinar, we seek to explore whether and how innovation in social protection systems can make them even more effective at driving such transformation. A couple things to note before we dive into today's session is that the webinar is being recorded and the presentation will be made available to participants and the audience following the event. And there's an automatic captioning feature available for this webinar. So if you'd like to view the captions, you can select the captioning button in your Zoom console. And just a reminder to please use the chat box to introduce yourself or to share resources or links or to make comments throughout the webinar. But if you have questions for the speakers and panelists, please write them in the Q&A box and not the chat box. This will ensure that the speakers and moderators have easy access to your questions during the discussion. I'll quickly give a snapshot of today's agenda. First, we will feature 3 short presentations that explore the range of constraints and the opportunities for innovation in social protection systems. Then Lawrence will facilitate an interactive panel discussion with our distinguished speakers that will help identify the pathways and some practical actions for enhancing innovation in social protection systems. We aim and will do our best to have ample time at the end of this session following the panel discussion for Q&A with the audience. So again, please submit questions to panelists in the Q&A box, and don't forget to please contextualize your questions so it's very clear which speaker or speakers they are directed to in the Q&A. In the general sense, innovation can be thought of as the process of creating improved ideas, solutions, or approaches that deliver value or lead to improved results. And in social protection systems, innovations can take many forms: more adequately designed benefits, more effective targeting approaches, enhanced delivery mechanisms, monitoring systems, and the list goes on. And the speakers and panelists joining us for today's conversation have rich firsthand experience engaging with such innovative solutions in social protection contexts around the world. And amongst them, they hold diverse and complementary expertise that will surely make today's discussion an insightful one. Our speakers include Dr. Raghav Puri, a research associate at the Tata-Cornell Institute for Agriculture and Nutrition, Mr. Crispine Emadau, the Senior Social Development Officer at Kenya's Ministry of Labor and Social Protection, and Mr. Niels Grede, representative and country director of the World Food Program in Colombia. We will also be joined in the panel discussion portion by Ms. Annalise Borel, a senior advisor for nutrition and social protection at UNICEF. I will now invite our first speaker, Dr. Raghav Puri, to kick off today's discussion. Raghav is a research associate at Cornell University's Tata-Cornell Institute for Agriculture and Nutrition, or TCI. His research focuses on the implementation and impact of health and nutrition policies. His current projects explore the true cost of food-based safety nets and how conditional cash transfers influence maternal and child health. Raghav, we're looking forward to your presentation, and the floor is yours.
Thank you, Anthony, for that introduction. So I'll be talking about policy innovation in food-based safety nets, and I'll focus on the role of political economy and governance. So before I begin, let me begin by talking about what are these constraints to innovations. So when we're thinking about political economy constraints, the ones that I'm going to focus on are vested interests of certain groups. These could be farmers, politicians, the beneficiaries themselves. Also electoral concerns, which limit how much innovation can happen, whether it negatively impacts certain groups or whether it positively impacts, in which case the innovation is more than welcome. Finally, governance constraints. Now, the ones that I'm going to focus on here are centralization of decision-making, which often limits experimentation, especially at the state level, at the subnational level. Also part dependency. A lot of these programs, when you're talking about food-based safety nets, continue because there's been so much investments historically in these programs that it's difficult to overhaul. Finally, limited state capacity. This is a very important one, especially when you're talking about technological innovations, because what looks great on paper, when it hits the ground, a lot of times there are issues with implementation and the ability of bureaucrats to implement these programs or innovations. So I'll focus on India's public distribution system, but these lessons are relevant to many in-kind or voucher-based programs that involve procurement of food. So I'm thinking Indonesia's BPNT, Iraq's PDS, or other similar programs, school feeding programs across the country that do public procurement. So it's relevant to all. So a very quick introduction to India's program in one slide. So it begins with procurement. Procurement is a huge part of it. In 2024, the government procured 78 million tons of rice and wheat. And just to put it in context, that's 31% of the total rice and wheat produced in the country, which was bought by the government. So we're already seeing the large possible impacts this food-based safety net can have on the food system in general. This grain is then transported to fair price shops, 500,000 of them, and most beneficiaries traditionally have been attached to their nearest shop. So they can only go to the shop in their village or in their locality. And when we come to beneficiaries, they get 5 kgs of free food grain every month per person, and about 900 million individuals, which are 65% of India's population. So it's very high coverage. I always joke that this program covers 10% of the global population. So the program started in 1997. It was a targeted program covering 1/3 of the country, but it was marred by low coverage, poor targeting of beneficiaries, a very high diversion of food grain. Within 10 years, what started happening is, because, again, talking about part dependency, centralization, this was a very top-down program and very little room for maneuvering or changing the way the program was functioning. But by 2009-11, what came about is a lot of states started experimenting, and there was innovation at the state level. One state expanded its coverage beyond this 33% using their own state resources. There was another state that attached GPS trackers to the truck so that grain was not being stolen. And so all these innovations at the state level then culminated in what was the National Food Security Act, or the Right to Food Law, which incorporated all these innovations, but at the national level, where the national government provided money to reform PDSs across states, across India's 28 states. So let's look at what these innovations were. And while we're looking at this, we have to keep in mind that throughout this duration of the first 15 years of the PDS, and even today to some extent, there's always been a push to move to a cash transfer program. And so when we're thinking about innovations in the PDS's context or India's context, they were happening with the idea that no, the in-kind program is here to stay, and we have to innovate within the parameters of this. Again, and I'll talk about why that was the case. So the first big impact of the NFSA was, or these reforms were, that coverage went up from about 23% to 70% now over 20 years, a huge increase in coverage. And the other big story was reduction in the diversion of grain. So like I said, in 2004, half of the grain that was put in the system didn't make it to the people. And so either it was stolen or lost in transition. And this went down to about 41% before the Food Security Act came in. And finally, now it's come down to 15%. A half glass full story, great progress on this front. A half glass empty story, there's still 15% diversion in the program. So how did this happen? A large part of it was driven by, just increasing the coverage and identifying the right beneficiaries. But there was also a big story about innovation in terms of the supply chain, so computerization of the supply chain. And a big part of it, very innovative, but also yet controversial part, was digitization of the last mile transaction using a biometric ID. So before this program, if there were 100 families coming to attached to a shop and 80 showed up and 20 did not, the shopkeeper could just sign in the register and steal the remaining 20 families' food grains. However, now they've introduced a digital technology with biometric authentication. So unless a person comes and does a biometric authentication using this machine, grain cannot be distributed. So this was a big achievement. However, I say it was controversial because even today, there are cases of exclusion. And so the way it was designed is something we can talk about in the panel discussion. Now, even though it became easy to monitor who was getting the grain, we still couldn't monitor how much grain was being distributed. And so this leads to the next generation of reforms, which is food grain ATM. So these are being piloted by the World Food Program, where you don't have to interact with the shopkeeper and you can just get the correct amount using these machines. Another big innovation was portability of food benefits. So for the longest time, people were attached to their shops. But in 2019, the government came up with a system where you could go and buy a food grain anywhere in the country. And so what we've seen is from about 6% of transactions being portable, so people not going to their shop, but to any other shop in the country, it's now gone up to about 16%. Again, a very important innovation in terms of the in-kind food program, bringing in competition between the shops and also helping migrants. But what I focused on right now is the distribution side of the story. I think the largest impact of in-kind food-based safety nets comes from the public procurement side that has huge impacts on the food system that is often ignored in social protection because, that's more, the agriculture side of things. And so when we look at the PDS, one of the big issues is that it's guaranteed prices for farmers before the growing season. So this definitely has an impact on what is grown and what is consumed in the country. And so these guaranteed prices for rice and wheat result in the overproduction of these crops, often at the cost of other crops, other climate-friendly crops, such as millets and pulses. And so what you see here is an increase in the area of rice, increase in the area of wheat over the past 60 years, but a decline in major millets, so sorghum, finger millet, pearl millet. What this does in turn is lead to some negative environmental impacts from rice and wheat cultivation. And this is particularly true for areas which have declining groundwater levels or intensive cultivation. In India, there are two states, Haryana and Punjab, in the northwestern part of India, which have experienced unsustainable water use, GHG emissions, and decline in soil health. We published a study last year that talked about reducing the true cost of food-based safety nets. So not just focusing, on the food subsidy, which is what policymakers do, but also talking about, the cost involved of declining groundwater, GHG emissions, and other subsidies like fertilizer and power. And a large part of this, even though we know what's going on, is because there's a political economy constraint of farmers' interests and also part dependency because India's had this program for so many years. But within that scope, there's a progress being made or small incremental changes being made to reduce the impact of the PDS on the larger food system. So what are the options here? The first option is adopting sustainable practices to make rice and wheat production sustainable. The problem with that is a lot of the government's policies, fertilizer subsidy, power subsidy, actually encourages overuse of fertilizers, overuse of groundwater. The other option is promoting local procurement. So rather than procure more than 50% of PDS as grain from these two states with declining groundwater levels, moving it to other parts. However, there's been some amount of backlash from the farmers if that was to be the path forward, and I'll talk about that in the next slide. Finally, replacing part of the rice and wheat allocation with pulses and coarse grains. Again, this is possible, but the scale of production required and procurement required for pulses and coarse grains will require new investments in new states where these crops are grown. A more radical idea to this, again, that has been recommended for the longest time and discussed, but never really implemented in India, is replacing price support for farmers and in-kind food transfers for PDS beneficiaries with cash. And so I wanted to talk about the political economy constraints of that, because that has played out over the past 5 years in India. So replacing price support for farmers with cash transfers was an idea that's always been mentioned, in World Bank reports, and especially from economists, the idea that it's so efficient to get all this grain and then transport it and distribute it to the PDS. And we never knew what would be the reaction of removing these price supports. But we came close to this, where in 2020, the Indian government passed these farm laws to modernize Indian agriculture, liberalize Indian agriculture, bringing in private players. And while it didn't specifically mention that guaranteed prices will go away, it was the farmers saw this as the foundation for that to happen in the future. And so they protested. The protest went on for 1 year, 4 months, leading the government to actually repeal the farm laws. And now, instead of a demand for, after the demand for repealing the farm laws, the farmer groups are now demanding a legal right to guaranteed prices. So it's very much one step forward and 2 steps back, because we've gone a full circle back to making guaranteed prices a legal right. A final point is about replacing in-kind cash transfers with cash transfers. Now, when the Food Security Act came in, one of the controversial provisions in it was that it allowed states to replace in-kind transfers with cash. You could do it for one city, you could do it for one neighborhood, 3 villages, at any scale that the state wanted. However, 12 years later, none of the 28 states have introduced cash. And that, again, talks about part dependency, centralization, but also electoral concerns, because in many states where the PDS works, people prefer the in-kind. A large part of the electorate prefers in-kind transfers to cash. But also its linkages to public procurement. So, what happens to public procurement if you move to cash? So a final thought is a few possible future pathway, and this is coming back to innovation and food-based safety nets, is not talking in binaries. And so maybe thinking about a choice-based PDS that allows households to choose between in-kind and cash transfers, at least on an experimental pilot basis in the big cities. To conclude, political economy and governance constraints have a huge impact on the design, implementation, and long-term sustainability of innovations. Often technocrats don't see this, and when we're proposing solutions, we're not accounting for the realities on the ground of political economy and governance. And some ways to improve this innovation and social protection is to promote decentralized experimentation. This is what happened in India in 2009. Late 2000s, when states experimented, and it still goes on. Human-centric designs, and this is something GAIN has been promoting to increase adoption and reduce exclusion, especially for technologies that involve internet connectivity, banking accounts that a lot of people are not familiar with. And finally, building administrative capacity to scale up innovations. This is a very important point. I'm a public administration person, and so I see this on the ground all the time, where well-intentioned innovations don't do well because there's no state capacity to deal with them. Thank you.
Thank you very much, Raghav, for a truly enlightening presentation, and thank you also for staying on time. Now we will hear from Mr. Crispine Emadau, the Senior Social Development Officer at Kenya's Ministry of Labor and Social Protection. Crispin will share his invaluable experience on modernization and embracing digital technologies and social protection systems, particularly highlighting Kenya's innovative enhanced single registry system. We're looking forward to your presentation, Crispin. The floor is yours.
Thank you, Anthony. So, I'm going to take us through an innovation, the Kenyan context of an innovation in social protection. And basically what I'm going to cover is an innovation that took Kenyan social protection sector, specifically government-led social protection sector, from a point of grasping at straws to a point of being shock responsive ready. So basically, that is what I'm going to take us through. It is one of the innovations that has really changed the aspects of how we deal with social protection in the country, and we call it the Enhanced Single Registry. And I'll take us through this. But before I start, I would want to say that for Kenya, we've had a journey, and the journey for Kenya has been that we started from a very small perspective of social protection, whereby we started with the actual transfers to the groups that required support from government in relation to either shocks or vulnerabilities. But with time, we realized that delivery of these transfers in terms of social protection challenge. And we've experienced two main challenges in delivery of these cash transfers. And for the two of the challenges mainly were coordination and inclusion. And we talk about coordination and inclusion. Mainly, we had a challenge whereby there were so many entries when it comes to inclusion. Each and every actor within government and outside government was procedures and entry level for social protection interventions. So you has several windows to get into programs being charged by the State Department of Social Protection. But at the same time, we may what
Crispin,
benefiting Kenyans from.
Mr. Crispin,
So
I do
from there,
apologize.
initially we had what we call registry in Kenya for some time, since I think 2013 to around 2016. Yes. Can you hear?
Crispin, your audio is breaking up
Go
quite a
ahead.
bit. I'm wondering if perhaps you could try closing your video.
Can you hear me?
Crispin, are you there?
Can you hear me now?
Yes, yes, now you're audible.
Okay, so I'll start from where I was. So I talked about Kenya's challenge in social protection delivery, mainly being inclusion and coordination, whereby we had so many gateways to inclusion in social protection in the country, whereby it was being managed by several actors that is coordinating social protection in the country. And also on top of that, we have and we will still have are doing so much in terms of social protection in the country, but the information about what each and every one of these actors is doing is Kenya felt that by having the integrated beneficiary registry in place only was not sufficient enough to be able to resolve the issues of coordination and inclusion, basically moved Kenya from grasping at straws in terms of emergencies to being shock responsive ready. And when I talk about being shock responsive ready, I'm talking about being shock responsive ready in the country. And this was made possible by the introduction of what we call the enhanced single registry in Kenya. This is a system that we call a repository of data on vulnerable households in the country. And this is a system which actually combines two databases. You've seen that in my definition, I've talked about enhanced single registry. That means we had a single registry in place in the country, but we have inclusion and coordination. And for us to resolve that, we introduced what we call a social registry module within the existing single registry in Kenya to ensure that we are able to do proper identification and registration of the vulnerable populations in the country and have these data in a database ready for purposes of social programming. And we rolled out the intervention where the initiative whereby we went down the ground to the village level, to the household level of potential beneficiaries in the country and have them ready for sure that when an actor wants to resources in the identification and registration, but rather they would invest it in the actual intervention and the stipend itself. So that is how we gave birth to the enhanced single registry. And so that is where Kenya is now. And I would want to take us through the delivery chain in terms of social protection in Kenya, so that I link it to how the enhanced single registry has revolutionized the aspect of innovation in terms of social protection delivery systems. And in this case, whereby we always know from the delivery chain in social protection, we start always from outreach and we go all the way to management and monitoring of the actual intervention on the ground. But with many programs, complexities increase. That means if I have 5 programs in place, that means that each and every one of these programs need to do an assessment and needs to do potential for eligibility and needs to be able to move them to enrollment, then move to management of these benefits, which for us felt that it was so disaggregated that we did not have a coordinated approach of doing this. With the introduction of the social registry in Kenya, the aspects of assessments of potential eligibility for all vulnerable households in the country is taken care by one platform in the country for all actors, both state and non-state actors. And this is the enhanced single registry. And that means we were able to cut the cost of identification and registration for each actor in the country by almost half, because now the identification and registration and potential eligibility assessment for the characteristics of the household was already taken care by government through the enhanced single registry. And the actors would only come in place when they are doing the actual enrollment of the programs and enrollment of the Kenyans into that program and doing the actual intervention management. And this for us was a revolution that actually gave us a very good milestone, because currently the government was able to roll out a registration of poor and vulnerable households across the country. In Kenya, we have 47 counties, and the registration was complete as at 2024, December. And since then, this data has been utilized for shock responsive social protection and other aspects of social protection in the country by not just government only, but by even other actors, humanitarian actors, non-governmental organizations, and even individuals who are doing social protection in the country. The aspect of identification and registration has been taken care by government, and the data is ready to inform these decisions in the country. So basically, that is what the registry has done in Kenya. And what aspects of the registry have we gotten that we can say that have improved how we work in the country? Mainly, I'll start with the policymakers. And for policy and planning, it has allowed us to do identification of intended populations and profiling their needs and characteristics at one platform for each and every actor. By doing this, we are able to make sure that we have a harmonized database that each and every one of us is able to use, because it has flagged out the various aspects that they will need for their social protection programming. Secondly, we have the monitoring on who receives what for which program, and we are also able to identify gaps in coverage and duplication and for complementarities. This one has allowed us to form different programs who are doing complementary services in terms of economic inclusion services and other services, to ensure that we are able to give a complete data set with information relating to who is benefiting and which program are they benefiting. Social protection during crisis. I'll use a good example of the recent drought in the country, that the registry was used as one of the best databases that was used to get the data for response for during that drought. For program administrators, mainly it has allowed us as program administrators to have shared resources for intake. That means I do not have to do my own intake and registration in the front office or something like that, but the government would have taken care of this, and I would just come and dip into this database and be able to target from the database. Then it has also lowered administrative costs that were previously being incurred by the different actors during identification and registration, and as for case management. A good example of referral for Kenyan perspective is we've referred all the beneficiaries, the potential beneficiaries in the social registry to our Social Health Insurance Authority for purposes of coverage in terms of social health subsidy insurance. Then for the people, because at the end of the day, all of us are trying to do something for the people. What has it benefited the people of Kenya? So it has promoted awareness of and access to numerous benefits, because the entry point now is one for every Kenyan. And by getting through that entry point, you are presented to all actors in the sector for them to be able to target from the data that we have in. So that has benefited the Kenyans, and a Kenyan can apply for many programs at once with a simpler procedures through the registry, and they are able to be referred to different programs that they are eligible in. Then access to their data and information on benefits received and the eligibility status is available on the registry for all Kenyans, and this is information that is available publicly for each and every Kenyan. So the next thing I would want to mention is the ESR, the Enhanced Single Registry, in the Kenyan version of the Enhanced Single Registry. Countries will have an integrated beneficiary registry on their own, and then a social registry on its own. But for Kenyan version, we have one system that has both the social registry that feeds into the programs and the integrated beneficiary registries that pulls back data from the programs for reporting purposes. And this for us has given us an advantage when we are monitoring and reporting on social protection. In this program reports back to the thing about the architecture of the Kenyan Single Registry and what it entails. So basically we have two main modules, which is the social registry module and the integrated beneficiary module. The social registry modules allows the government of Kenya through the State Department for Social Protection to household list. That means identify households that are considered vulnerable in the country for them to be registered. Then after they've been identified, they're able to be registered and they're able to be presented to all the other actors for purposes of them targeting from that database. We're also able to manage grievance and cases and do update management for the central registry on behalf of all the other actors. For the integrated beneficiary registry, it's mainly an interoperability layer that allows us to pull data from other program management information systems and be able to report in one common platform on behalf of the sector in the country. And it is also linked to external databases that we use for validation and verification of the data that we have in the registry. And each and every program linked to the registry is able to pull and push data from the registry. When I talk about pulling and pushing data from the registry, what I mean is programs are able to target from the social registry module of the Enhanced Single Registry and they are able to feed back in terms of reporting on the integrated beneficiary database of the enhanced single registry. In this case, we are able to have one system that informs the entire social protection sector in the country. And for us, that is an innovation that was a game changing, and it has really helped us in informing data-driven decision-making. So I would want to stop here, and I will leave us with a link to the Kenya's Enhanced Single Registry. It will take you to the public platform whereby you can interact with it and be able to see what I've just said. Thank you.
Thank you very much, Crispin, for sharing this very exciting work with us. Certainly a lot of lessons to be taken away from that innovation. Our final keynote presentation will be from Mr. Nils Grede. Nils is the representative and country director of the World Food Program in Colombia. And he has been working for more than 20 years on development and humanitarian programs with a global perspective. His commitment to these efforts have taken him to Africa, Asia, Europe, as well as Latin America. And prior to his appointment in Colombia, Nils served as the director of the Changing Lives Transformation Fund at WFP headquarters in Rome, where he strengthened and executed innovative and sustainable initiatives to provide food security for vulnerable populations in various countries. Thank you very much, Nils, for joining us, and the floor is yours.
Hello, good morning, good afternoon, everyone, and thank you so much, Anthony. Let me just go into presentation mode here. There we go. So very interesting. Crispine talked about the single registry, which of course many countries are developing or have developed, which is the basis often for mostly cash-based social protection programs. And Raghav has spoken about the world's largest food-based safety net, which of course is also part of social protection. I started off my thinking around this presentation by saying, well, linking between social protection and food systems, and for WFP, I would like to add nutritional outcomes that these food systems provide, has of course one big constraint or limitation or obstacle, which is that most social protection programs in the world are not like the India one, but they do transfer cash. And of course, for good reasons, whether they're conditional or unconditional, and there's a whole science around whether the conditionality works or not, and I'm not going to get into that. But ultimately, by giving beneficiaries cash, we allow them to make choices. And I think that's the point. It's around the dignity of beneficiaries or recipients of social protection benefits. It's about them allowing them to buy what they really need. They best know what the gaps are in their household rather than just getting rice and wheat, as Raghav described. It's also around dignity. So there's many reasons that social protection systems very often are cash-based. But for us, as a UN agency, but for all of us in the development community, that's a big challenge, because how do we, once we give cash to people, we also allow them to do with the cash what they think is most necessary, what is most needed, and they make their choices, and we lose control to some extent over those choices. So I thought, let me start by asking artificial intelligence. So what would happen if suddenly we had, let's say, no more poor people in the world, or all the poor people in the world had suddenly doubled their income? What would happen to the world? Would that be a positive? We would think that's positive, right? Less poverty. So first thing is, what I love about artificial intelligence, they could have just said it's a dumb question, but no, they encourage me. They said it's a fascinating question. And artificial intelligence came back with three scenarios. The first one is a positive scenario. So we get inclusive growth, people invest that money well, they have better nutrition outcome, governments seize the opportunity and make sure that there is the right education so that economies grow, and so on and so forth. The second scenario is more around rapid demand, unsustainable expansion. So what would be the first thing that happens if all the poor people have twice the income? Well, they would upgrade their diets. What would they mostly be investing in? they would probably move to much more animal protein-based diets. So that would mean a lot more need for land, for cattle, pigs, etc. So that would be quite negative for the environment. And the third scenario is kind of similar. Without supportive policies, the income boost leads to short-term gains, but long-term instability, surge of unregulated land grabs to produce all that additional cattle, urban sprawl, increased pollution, and so on and so forth. So not necessarily, so if we were able to inject billions of dollars into social protection systems as cash, we wouldn't necessarily get a better world in all aspects. So that was my first point. So that's the takeaway. If we expand social protection in an unintelligent way, just by distributing money, that could be very harmful for the world. We have to do it smartly, linking income support with nutrition education, agricultural incentives, and environmental safeguards. So what I'm going to do now is go through a few examples of how we can do that. And these, almost all of them come from work at WFP somewhere in the world. Because I'm coming from World Food Program, I'm going to use the categories of food security, availability, access, stability, and utilization to structure these examples. And I'll be very brief about each of them, and all of you can find probably online more information or contact me if you want more information about specific ones of these solutions. So let's get started. I'm not going to go into availability because that's not where World Food Program works. That's more our sister agency, FAO. So I'm going to jump into access. So how can people obtain access to nutritious food, physical access, and economic access? One example, and I'm going to take us to a school meals program, is El Salvador, where there has been a school meals program for decades. But its biggest challenge has been that 80% of the schools do not have the facilities to prepare nutritious meals, hot meals. And so what often happens, and this is El Salvador, but it happens in other countries. Here in Colombia, the same happens. What governments do instead, they give what is called an industrialized ration, so packaged foods that are not very healthy. So an innovation that WFP developed in El Salvador is what is called Kitchen in a Box. It's a container that comes with all the equipment where the team of chefs that serve the school can prepare the food. It's a pilot so far, benefiting 3,100 students, but it's a way to reduce the need for investment by governments into kitchens and dining rooms in these schools where often there is no space, and it's a lot cheaper way to do so. So that's one example. Another example, also from El Salvador, from my time back there around 10 years ago, there was a big challenge around malnutrition, still chronic malnutrition, so stunting, and health centers were distributing a supplement, a nutritious supplement for pregnant, lactating women and young children. However, the system wasn't working very well. Nurses really don't like to manage stock. Most of the health centers didn't actually have a proper storage room for this product, so often the storage conditions were not ideal. And nurses really want to focus on doing what their job is and not distributing food. At the same time, there's another issue, whereas, through a government program, social protection program, maybe 5% or 10% of the neediest women get this product and their children. Really, the entire population needs it. It's the right product for everyone, regardless of whether I'm poor or not. But the system that was set up just made sure it measured poverty and then gave it just to the poorest of the women. So what we did was to develop a food that is similar, put it on the shelves of the country's largest supermarket. And in the health centers, we gave vouchers so that the nurses no longer would have to manage the inventory. On the flip side, they would go to the supermarket whenever it's convenient for them. They could pick up the entire quantity for the whole month at once. They could go several times. And we took away all that stock management from the nurses who were really happy. And at the same time, the product was available for somebody like me, who, if I have a young child, may want to buy it. and I could now, for the first time, access it through regular retail channels. Now, this type of product exists by companies such as Nestle, but it's normally typically very expensive. So this was low priced, so almost sold at cost. So here, another innovation that touches on social protection. Let's look at utilization. I'm going to skip this one. Fortification is a big topic. If we want to improve nutritional status of populations, we need to give them access to more fortified food. I don't know, for example, whether in the public distribution system in India, the rice or the wheat is fortified. And this is a very good example. If we're giving them unfortified rice and wheat, then, we're not necessarily doing, we're alleviating poverty, but we're not doing the right thing in terms of nutrition outcomes. And regardless of India, if we think of cash transfers, as I said in the beginning, we give away our ability to influence what people do with the cash. So whether they do buy nutritious food with it or not. So in terms of fortification, of course, what do we need to make sure? We need to make sure, and this is also something that GAIN has, of course, worked on a lot. We need to make sure that through legislation, fortification is standard, and that staple foods that most of the population eat on a daily basis are only available by law in fortified version. Fortified, of course, with a premix of micronutrients. In many countries, the issue around this is even there may be legislation that imposes that certain staple foods have to be fortified. But the issue often is that the mills that are producing the rice or the flour are thousands, tens of thousands in a country, and that the compliance with the legislation is really poor. And the challenge usually is for these small millers that in terms of the work that they normally do, they don't know where to buy the premix, and they don't have machinery, equipment that allows them to mix and to dose the right quantity. So here is a solution called Sanku that comes from Tanzania, but there are several programs that are very similar with different names in different countries, whose aim is to go to these small mills to make a solution like a do-it-yourself kit available to these small mills, so that allows them, without a huge investment, to actually comply with the law and fortify whichever staple food they produce. One more example, back to Latin America, to the Amazon. We're about to go to the COP. Well, we're not going, but we're about to see the COP in Brazil, in the Amazon. Here's a very interesting study that the World Food Programme did. What would happen if we switched the general context is that the diets in the Amazon, overall, the populations are relatively poor. The diets often rely on ultra-processed and imported foods, which replace very often the traditional diet, which reduces the connections with cultural heritage, which impacts biodiversity, but also which doesn't deliver good nutrition outcomes. So we did a recent study in two countries, in Colombia and Bolivia, where we simulated if, for example, public programs such as school meals programs that use food would switch away from things such as maize and wheat and would go to local Amazon commodities. In this case, there is you see on the picture here, you see acai, which I think has become a superfood all over the world. Many people know about acai, but that could also be used a lot more in local diets than is currently the case, instead of using other staple foods that are not locally grown. And the interesting outcome from the study is that it creates local jobs. It increases the income. So in this case, there was a small pilot, so that's why the numbers are small. But the important takeaway from this study is that by switching to local foods, we create jobs. Local families increase their income. We improve diets because usually these traditional foods are more nutritious than the imported ones. We reduce the carbon footprint, very important if we think about climate change. And overall, we boost purchase value in these populations. I don't know how I'm doing on time, but I think I'm going to stop here. These are just a few examples of how we need to think when we largely rely on cash transfers for good reasons in our social protection systems, that we need to do a lot of work that makes sure that people actually can use that cash in beneficial ways and not in ways such as what the initial scenario from the artificial intelligence told us, that we're basically harming the planet if we're reducing poverty. Thank you very much.
Thank you, Nils, for the presentation, and thank you to all three of our wonderful speakers who have really set the stage for what innovation means and should mean in the context of social protection systems. We'll now move into the panel discussion portion of today's webinar. And before I hand over to Lawrence Haddad to moderate that discussion, I want to welcome another esteemed guest to join our discussion panel, Ms. Anneliese Borrell. Anneliese is currently a senior advisor for nutrition and social protection with the Child Nutrition and Development team at UNICEF, where she's working to strengthen UNICEF's contribution to policies, systems, and national programs on social protection for nutrition through leading knowledge and learning, guidance, partnerships, and a community of practice. Welcome, Anneliese. So glad you're with us today. And Lawrence, I invite you to kick off today's panel discussion.
Thank you, Anthony. Hope you can hear me okay. Yep. Welcome all four panelists. I must say those three presentations were absolutely excellent, and I was frantically taking notes. I love in Raghav's presentation, I love the fact that he basically said stuff looks good on paper, but when you actually have to implement it, the more complex it is, the harder it is to do. And I love the way that you built in choice-based opportunities within a really strong democratic tradition. Crispine, I thought, it's such an obvious thing to do, but so what you, in terms of generating one register, because it generates this social registry and this beneficiary registry, but it's so difficult technically to do and politically, and politically and in terms of worldviews, very, very difficult to do. So I think we want to hear a bit more about, you made it seem easy, but I know it wasn't. So what were some of the difficulties there? And Nils, loved all your examples. Loved the fact that you said social protection doesn't have to be a good thing. If the governance is weak, if the enabling environment is weak or pointing in the wrong direction, we could get negative outcomes. And I thought you gave some really interesting examples. And Anneliese, welcome. It's great to have one of our colleagues from UNICEF here. It's such an important organization. My first question is for Niels, and it's kind of a basic question. Why is innovation in social protection so important? I think you've kind of answered it already, but I wonder if you could have a go at that question, and maybe sort of one of the things I'm wondering all the time is, well, what's driving innovation? We know necessity is the parent of innovation, but what's driving innovation in the context that you operate in? Over to you.
Thank you, Lawrence. Well, first of all, I think for the reason that you just said, which is that often things look good on paper, but then when we implement them, we realize we get adverse. We sometimes get some good outcomes, but we often get, in the same package deal, adverse outcomes. And so I think we want obviously good outcomes for our beneficiaries, for those who are entitled to those social protection systems. And so we're constantly trying to figure out how we. So I think it's a learning process. You start something, then you realize what's going wrong, and then you try to innovate to kind of get the benefits, but not get the adverse outcomes that you sometimes get as on the side, so to speak. For example, I'm just going to give another example, which is school meals programs globally. I think 400 million children are getting school meals. Of course, that's probably, if I assume that was one buyer, that's probably the biggest purchaser of food anywhere globally. But these programs are usually set up to be efficient, cost efficient, to provide a certain number of calories. In different countries, there is different focus on whether it has to be nutritious or not. But there's a huge potential there to have that purchase volume benefit the food system, to move things in a way that also improves the food system and improves outcomes for local populations. However, most of those programs are very centralized and buy from large agro companies, intermediaries, and do not really get to the smallholder farmers, who are often the parents of the children that we're feeding, right? So hugely complex to move if you're feeding hundreds of thousands or millions of children, to move from buying in 1, 2, or 3 places, which is, and setting up a complex supply chain, but it's manageable because you're buying from 1 or 2 or 3 big companies. If you want to decentralize and connect schools to many smallholder farmer associations. So that's the challenge we have everywhere in the world, and we're in different places in different countries. But what we need innovation to figure out how can we, and in the digital age, we of course have a lot of potential tools. How can we figure out, if we give the budget to the schools to buy, for the schools to manage their local supply chain and to benefit people in the area? So I think we have all those tools that the digital era gives us, but we haven't really figured out how to do it in a sustainable way that is replicable. So that's one example where innovation is needed so that we actually produce better outcomes, not just for the children, but also for the economy, the local economy, and for their parents.
I mean, you mentioned school meals, and something that Raghav said reminded me of the kind of the street level bureaucrats work that was done quite a bit of time ago. These are the bureaucrats who are mostly in contact with members of the public, and they often have to interpret policy and have to deal with badly designed or badly thought through policy. And I will come back to it because I don't think we've got time to delve into it too much. But I do wonder about school meals and some of the innovations around school meals. The teachers are really going to have to deal with this. And have we brought the teachers' views into this? There's so much political economy with a big P and a small p to figure out with social protection. And I thought Crispine's point about keeping the more programs there are, the more complex it is. So I've just got too many questions to ask you, but I don't have time to ask them all because they're so fascinating. Colleagues online, please put questions in the Q&A box. We'll come back to these. Annalise and Raghav, questions for you really around, give us examples of innovations that really excite you in certainly around connecting social protection to food systems. I mean, Raghav has given a couple, the portability one and the choice-based ones. Maybe you could tell us a bit more about how the portability and choice-based ones are actually working out. And Annalise, maybe you could tell us a bit about UNICEF's experience of linking nutrition to social protection, whether it's on the choice-based, the consumption side or the production side. So Raghav, why don't you go first?
Why don't I let Annalise go first?
Okay, Annalise, you go first. I was giving Annalise some time to get acclimatized to the event, but go ahead, Annalise.
Thank you very much, Lawrence, and fantastic to be here. Thank you, colleagues. Great. And before I do give examples, Lawrence, I'd like to just pick up a last point on terms of what drives the innovation and what is important, just to frame my examples. I think a couple of 3 points. One, that I think any sort of innovation in this area of work must bring together at least the health system, the social protection system, and the food system, and that we have to keep driving any innovation that keeps these linkages, because the more we do that, the more sort of impact I think we can have on nutrition. So moving beyond just the food and then the social protection system. The second point is in terms of framing is from UNICEF's perspective, where we do see the food system as absolutely critical to in nutrition, of course, but that it is failing. It is failing children. It is not providing the quality of diets that children need across the world. And so we see the key interventions in terms of changing foods, and of course we've discussed this at length, the actual foods that children eat, the practices that the food practices of families, and their food environment. And I think those three, as we keep those entry points in terms of synergies and how the social protection system can improve each of those. The third point, and I think this is for me is most important, is that around framing is that any innovation must drive system strengthening, right? So if we're doing innovation, it must be for the purposes of scalability, of strengthening local, national systems, feasible options, and impact, of course. And I think with those three framing, just to give some examples, I think the sort of two broad areas that I'd like to give. One, innovations for system strengthening. And we often find that crisis or fragile context allows us to really build on national systems and strengthen them, adapt them to be better. The example I like to give is in Sri Lanka, where there was a maternal child cash transfer program, but it was only during the first 4 months during pregnancy. It didn't cover the period of 10 months for young children. When the COVID crisis hit, when Sri Lanka was faced a socioeconomic crisis, we worked with the government to extend that. So we built on the national system, but adapted it, built on it, and we developed a model with the government that allowed then children during that first 10 months to access a top-up cash, a social protection top-up, and then also strengthen the services and strengthen the local community workforce capacity. So just that example, I think, is really important because it's building on national systems, innovating, and then using that to then influence system strengthening and policies in the longer term. The second example, again, very similar, but the crisis in Sudan, I was just there last couple of weeks, that where we are, while the situation is a protracted conflict situation, very challenging, we're using cash transfers and social protection to address social norms. So women for the first time are opening bank accounts. So that whole sort of economic inclusion is an important one. And we're using the cash transfers as an incentive to come to the services and receive nutrition services, so linking the cash transfers with that. The third example, I think, is just sort of work that we're doing is this, taking long-term perspective, and I think something that UNICEF and WFP and our other agencies trying to link the social protection system, the health system, with the food production system. And in our really exciting work happening in the DRC and in Zambia, what we found is that while social cash transfers and linking to health services is great, governments are reluctant to take on that burden and expand those programs. We found that governments are more willing to take on and into policy where we link these programs with food production, local livelihood, small chickens and goat programs, small income generating. That model seems a more sort of suitable model, and of course in the long time very important. So I'll stop there with just some examples. I think in summary, thinking long-term, thinking transformative, and thinking across the three systems, but always using innovation for building systems.
That's very nice, a very nice 3-point summary. Thank you, Annalise. And I love the example from Sudan about bank accounts for women. Use social protection to leverage actually much more transformational changes. Thank you. Raghav.
I'll focus on one specific example from India. I study last mile delivery, and so I'm usually the skeptic in the room when a new idea comes up. So when you talk about portability, I thought, with the Indian PDS, I've been working on it for 15 years, so I've seen it through highs and lows. One of the big challenges is innovation happens within the scope of it being an in-kind food transfer. So that's kind of the limit that's set to innovation, where you're working within that system. And so when portability came, it allowed people to go and buy grain from any shop across the country. Earlier, they were linked to just their village shop that they could go to. And what that ended up doing is helping migrants and also bringing in competition amongst. So earlier, the shopkeeper could say, I'm not going to open the store. You can't do anything about it because you rely on the person. And now suddenly you can go to the neighboring shop. And what I showed you in the slide was 16% of people are using this option. But what was also on the slide was that only 0.4% are using it across states. And so we did a study last month. I was in India interviewing beneficiaries. And we're trying to understand in the big cities, there's so many migrants in India, why they're not using the portability option. And what we found was that, again, excellent innovation, the technology is put out, but the supply chain has not been linked to the system. So in many cities, shopkeepers refuse to give migrants grain. And so when I asked them, why aren't you giving it? Because that's the problem. That's the system rule in place. They said, well, these people are not voters. They're outsiders. And so I'm going to first give it to the voters who can go and complain to their local elected representative, but these people cannot complain, and so they're not my priority. So again, coming back to the political economy and the governance issues around it. So when you're looking at innovation, it has to, you have to walk till that last mile and make sure that it's being implemented. Again, a very important program, but not achieving its true goal and potential. Thank you.
Raghav, it's fascinating. Can I ask you a question? What's the best way to prevent those kinds of things happening? One of my colleagues again talks a lot about not postmortems but pre-mortems, if you know what I mean. Sort of thinking you're a skeptic. You focus on last mile solutions, and I think you're absolutely. I hear you, and I think it's absolutely appropriate. But how do we, the people sitting around designing programs, I mean, they've got to get out into the field and talk to everyone that's going to be affected by this. But it sounds simple, but why doesn't it happen more often?
I think, and again, in the case that I'm talking about, the government at the national level is a certain political party. At the state level, the city I was working in is also the same political party. So it's not even, the differing constraints. And I think a large part is these programs, particularly in countries, low middle income countries, they're so massive. And there's so much happening on the ground. There's so much innovation happening. You're bringing in the national ID, the biometric ID. You're trying to bring in all sorts of technology. There's a lot of technology coming in. And again, the intention is excellent. But I think what's ending up happening is, and it comes back to my point about state capacity, that, the people deciding what kind of technologies are going to be used in these programs are doing it before the foundational, or at least a basic level of technology is there. Just quickly talking about cash transfers, that's the other area I work on, maternal cash transfers. They were always seen as a game changer. They've been implemented at scale, but there are a lot of places, even now in India, where, you have to go and stand in line at the bank. And just adding on to Annalise's point, and this is a very, I think, good example of how programs fail. A lot of cash transfers now come to women. And so in a lot of my research, women have complained about that. And that was shocking to me because, I thought this was a very good policy. And the reason why they've complained is, especially in rural areas which are remote, they said this was the one thing my husband did. He went and stood in line and got the cash. And now only I can go because I have to do my biometric authentication. The other side of the story was that now, because technology is coming in, a lot of people have ATM cards. So suddenly, the money going into the female's account is irrelevant because now there's an ATM card in the household and a PIN. And so you can just, that autonomy goes away. So again, these minor issues that you said, somebody needs to go down and document these, understand what's going on, and then make tweaks. Again, I'm not, I don't want to throw the baby out with the bathwater. Portability is excellent, but these little tweaks and little understanding from government agencies could lead to so many more improvements.
They're teething troubles, but they could kill something very easily, couldn't they? Yes, thank you. Really great examples of that. Crispine, maybe you could tell us, I mean, what Kenya has achieved seems remarkable to me. In the UK where I live, there's a big furore about introducing ID cards. I mean, everyone's got a phone, everyone's got a driving license. Most people have a passport, but there's a big furore about ID cards. How on earth did this happen, this journey of creating this unified register? What enabled it?
So actually, it's not that we did not have a struggle or we did not have challenges at the start, because at the start of it, we had key challenges, mainly the challenges in terms of this, I would say, the silo mentality, whereby we are all doing our work, but that is it. Stay with yours, I stay with mine. But that had a challenge when government started coordinating social protection interventions in the country. And it was noted as the biggest challenge. The silo mentality was one of the biggest challenge. And government made it very clear that the coordination of social protection has to be charged with a specific body in government. And that was the beginning of this journey. And for us, by having that, people started understanding that by coming together, we are able to either save on resources, at the same time be able to explore and exchange knowledge. And for our case, the other things that really enabled us to be able to do this was, number one, I would say the skills and the skilled personnel within government that were charged with coordinating social protection. The government intentionally created a social protection secretariat in the country and put specific staff there to help with the coordination of social protection in the country. And this was what gave birth to the registry, because from there, the social protection secretariat was put in the ministry that was charged with coordinating social protection. And it started by first consolidating the interventions within that ministry. And when that worked, now we started moving out of the ministry and consolidating others in terms of reporting to the registry. And also the other thing was the government's digitization strategy. The Kenyan government has a digitization strategy in the last two administrations, whereby digitization of public service is very key. The government and the president himself is very intentional about it. And for us, by doing that, it gave the registry some impetus to move ahead and consolidate the rest of the programs, while allowing them the autonomy of doing their own, but also giving government a platform to report and do a identification and registration at a common point. The other thing is the political will. We would not achieve this without political will, because I would say our political class takes advantage of social protection as a key campaigning factor. And when social protection works, it works for them. And for us, those are the key enablers in the environment of social protection that allowed us to move to this journey to where we are today. Thank you.
Thank you. I mean, it sounds like government activism was pretty important. The fact that there was one ministry that was coordinating all of this was also important, and the technology was also important. Just give us a sense of the timeline from the idea of doing this to the realization of doing it. How long did that take?
So initially, I would start in 2004 to 2007, where the cash transfers were introduced in the country, and each department which was coordinating the cash transfer, implementing the cash transfer, was doing this on their own. But when it came to the registry, starting from the single registry and now to the enhanced single registry, this is a journey that started in 2015-2016 financial year, whereby the single registry was established and launched in the 2016. And then from there, that is when we felt that there were gaps the single registry could not address, because it was a beneficiary registry. Then in 2018-2019 financial year, through a project supported by the World Bank, we felt that we should expand the registry to include a database of potential beneficiaries. Okay. And that database was finalized in 2023 financial year, and the data collection was finalized in 2024. So that is the time it has taken us. Over.
Yeah, it's a really good reminder of how long these things take and how important it is to have sustained driving, people, a small group of people, or maybe it's only one person, just constantly driving this thing forward across regimes, across elections, across ups and downs economically, constantly batting away the barriers that come in their place. It takes lots of energy and yeah, lots of creativity. So thank you. Colleagues, I'm going to ask Annalise and Crispine and Raghav. I'm going to ask you one final question. Then I want to go to Q&A. So Raghav, I'm bundling you into question 4. So the question is for Annalise, Crispin, and Raghav. Where do you think innovation needs to happen in social protection, but you're not seeing it happening? What's the one area you'd like to see something happening that desperately needs to happen, but it's not? For one, even and maybe for want of trying, but it's not happening. So let me start with Annalise.
Thanks, Lawrence. I think my sense is I think if I can cheat and have 2 areas, and I think it's not that it's not happening, but
you can cheat. If you cheat quickly, you can cheat.
Okay. I think it's not happening, but I feel it's an absolute priority. One in the area, and I think Niels and Raghav have spoken about it, but it's about linking to sustainable production of local foods and how social protection can enhance access to those areas. And we are finding that, you know, again, we've been complementing social protection with top-up cash as in humanitarian and importing nutrient supplements, but how can we really bring about longer term transformative change in terms of social protection and cash being used to access locally produced fortified foods for children? And we have a commitment now within doing that things. The other area is, and I think it's something that I'm sure Crispin, the extraordinary work of Kenya, but Kenya is leading in this area, but I believe that there's more innovation needed, is in prevention, anticipating. We've got all the technology, we're anticipating shocks, but we're not triggering social protection and triggering nutrition, food, and health systems early enough for prevention. So we keep resorting back to sort of increasing levels of malnutrition. And I feel this innovation, what drives successful early prevention when we know that a shock's going to come?
Yeah, two points I really agree with. I don't need to answer it. I'm just throwing it into the mix. I would imagine homegrown school feeding, which has been around for a while, has some ideas. Not exactly the same as sustainably producing local foods, but it's related. I imagine there's some learnings there. And this prevention anticipation, this problem is as old as the hills, right? I don't quite know how we address that. Maybe there's some new technology that people could throw in the next time you get the floor. Let me pass now to Crispin. Crispin, same question. Is there an area that you think innovation is really key, but maybe it's not progressing fast enough and you'd like to give it a big push?
Yes, I would talk specifically of 2 things. And one is what we are even currently struggling with it in Kenya, but I think we'll hack it with time. The idea of citizen-centric innovations. We might have very good innovations at maybe implementers level, policymakers level, and all that, but the citizen on the ground, sometimes interacting with the innovations we've come up with, the citizen is still struggling with them. I know Kenya, most of the services have been digitized and have been taken to what we call e-citizen in Kenya, but we still struggle with that part. And I feel like if we hack that part.
Do you, sorry to interrupt you, do you mean that citizens are innovating, but their innovations are not being captured and built into the formal system? Is that what you mean?
No. I mean not citizens, but I mean in the aspects of social protection, the agencies implementing social protection are innovating a lot, but their innovations may not be in touch specifically with the citizen that is the target group in this case.
I see, got it.
And if we tweak these innovations to make sure that they touch the citizen, it becomes easy. Then number 2, I would also talk about, okay, I would be specific to the social registries. For social justice to be effective on the ground, early warning systems are very key. And I feel like it is a section we are still struggling in early warning systems, especially when it comes to drought, emergencies, and all those other things. Early warning systems, innovations in the early warning systems, we are still struggling in it. And it's something that we should look at and find a solution for us. That's what I would say. Over.
That's great. Thank you. And sorry for getting it wrong. It's the user-centric sounds like a lot of the human-centric work that's ongoing. And then finally, Raghav, what do you think, Raghav?
I feel like I'm biased by my research area, but I think one of the big issues, and I've seen this for 15 years now, working on various programs, social protection programs in India at least, is that new innovations, new programs, all these new things are coming up and sort of being, implemented at scale, but the people implementing them, street level bureaucrats, or just state capacity, not at the national or state level, but at the block, at the sub district level, and village level, neighborhoods, is so limited, and you have more and more programs coming in, and it's the same number of people implementing. Just to talk about, one of the examples that I always sort of get worried about is kitchen gardens. So one of the issues in India, for example, there's a school feeding program, there's a child feeding program, and then there's the PDS. There are lots of food-based safety nets. So big push is being made, for example, for kitchen gardens in child feeding program. So there's a child care center, you have a garden outside. And every time I discuss this with childcare workers, they get so upset and angry because they're like, who's going to take care of this? Like, I already have so much work. I am not going to take care of this. I leave the childcare center in the evening, somebody can come and steal stuff. There's just so many things that are not thought about. And the idea of a kitchen garden is so romanticized and beautiful. If implemented correctly, it sounds like an excellent idea. Rather than that, I think what, you were talking about homegrown, procuring from the community, I think is more, sort of market driven, and the responsibility is not on the state to, grow this kitchen garden. So I think these are things to think about, which is state capacity on the ground. Will this program create more work? And if it does create more work, please, create the street level bureaucrats who are going to take care of it, new positions, and don't add it to the existing workers. Sorry.
Thank you. One of the things I'm a bit worried about on the school meals work is the burden on teachers, actually. But Niels, I forgot about you, Niels. I'm very sorry. Please, would you like to comment on this question?
Sure. Well, connecting to this, I think homegrown school feeding, the biggest challenge is, and I think Annalise was talking about, how do we connect these two systems so that one system delivers for the other, right? The struggle is the smallholder farmer associations. First of all, sometimes they're not organized enough. Secondly, how can they reliably supply safe food? So, how can we make sure, it's not an option for a state-run school meal system that on Thursday there is food and on Monday there is not. And the biggest challenge with smallholder farmers is that they're not getting the right support, technical assistance, so that they eventually can become more reliable suppliers. So therefore, most governments resort to preferring one or two or three big companies that they source everything from and that can be reliable. And WFP, by the way, does the same. We're probably one of the biggest buyers of food in the world. We need to make sure we have the food when we need it. And there's been a decade of work of trying to buy more locally from smallholder farmers, but it's extremely challenging. And that's where innovation can come in to help us connect supply and demand. But we also need the food system to ensure that those smallholder farmers eventually upgrade their quality. The one issue, switching topics back to your question, what I would like to see solved, and I think it was interesting in Raghav's presentation where he talked about how difficult it is that there has been openness since 2013, if I remember correctly, to switch to cash. If in a district, in a municipality, in a state, maybe for certain types of beneficiaries, but it seems like nobody has ever tried it because of the systems just that have been around for years. There's a big resistance to change. What I would wish is that we could, in all cash transfer systems that exist for the poor all over the world, that we could integrate the component of the pregnant lactating woman and the under 5, So that automatically, I was describing this El Salvador example where we put a product on the shelves and we gave a voucher at the health centers. That was meant to be the precursor to being able to, when you give a cash transfer, the moment you know, as government, you know when the woman gets pregnant, right? That immediately, in addition to getting 100 pesos, $100, 100 whatever every month for her family, that for that period, 9 months of pregnancy plus the first 2 or the first 5 years, she automatically gets a voucher that she can pick up the right nutritious product. And that we take that to some extent away from the health system. And of course, I don't mean take it away in the sense, take the logistics away from the health system. Somebody else mentioned how, well, you're mentioning teachers all the time. Raghav mentioned the health worker that doesn't want to be able to worry about the kitchen garden. It's exactly the same thing. That should be automatic and the platform is there. Why can't we just add that component to it and relieve an entire sector from stuff? Health sector should not be focusing on sourcing and distributing food products. They should be focusing on the health job and then educating mothers around the use of that food. So that would be my dream.
Thank you. Thank you, Niels. It's great. I think I've done, colleagues, a miserable job of timekeeping, and I don't know if there's any time for a couple of questions. Anthony, do we have any time?
I would suggest maybe there's time for one of the questions from the Q&A and maybe just time for one response.
We've got a couple of questions we've had some questions from Anna, which have been answered. Ayala and Sarah. Colleagues, you can read them. Maybe we should just go to the general question from Ayala because it cuts across. Are there efforts to cultivate entrepreneurship amongst small-scale market actors? And I think you mean entrepreneurship within the social protection system as well as the adjoining food systems and health systems, I think. So, colleagues, anyone like to pick that up?
I'll respond very briefly, but I just think I'm building on Niels's dream, that in terms of, because I couldn't agree more with Niels in terms of the innovation around linking adding maternal and young children and linking that sort of voucher system to locally produced foods. And this is where the question around the entrepreneurship, I think that there is extraordinary entrepreneurship and we aim to do just what Niels is doing. So Niels, we'll link in with you to look at locally produced complementary foods that are using local products, but to a standard that's regulated by governments, etc. And but bringing in entrepreneurship and local resources from that local area. So yes, we feel very committed to that area and feel it must be a priority in terms of innovation.
Thank you, Annalise. And I'm really sorry, panelists, we don't have any more time. But I just wanted to thank you. You've been incredibly inspiring and refreshing to me, and I'm sure to all the other people listening in. Things I've picked up around how important path dependence is for all of this. It's, implementing these programs is difficult and is not easy, and any deviation from that is just more work for me, who's an implementer. So you've got to have someone constantly driving the innovation process and constantly asking the question, what's in it for all the different actors involved? And then of course, testing those assumptions about what's in it for all the different actors involved. The capacity on the street level is and the bureaucratic administrative level is very, very key. We often take it for granted, but it's often not there. And if we don't get it right the first or second time, often it just kind of kills the idea. There won't be a third or fourth opportunity. The political economy, the PDS example is a good one. Who is the PDS really for? Is it for the consumers or is it for the farmers? From Raghav's presentation, it made me think that it's really for the farmers because it's to give them a guaranteed price. That may be wrong, but the political economy is really, really important. I think giving as much choice as we can within a social protection program is really important. I love the example of moving. I love the example. I think it was Niels gave the example of vouchers to be redeemed in a food retail outlet that for foods that were just as equally nutritious and safe as the foods stored in the health system. I thought it was a really good example. And I thought Annalise's point about whenever you innovate on food systems, make sure it changes the entire system for the better, and make sure it keeps in mind food systems, health systems, and water systems. Don't just focus on one system. You may only act in one system, but when you act in one system, bear in mind the impacts and connections between the three. So I feel like the innovation of social protection for nutrition is in very good hands with the 4 panelists. I'd like to thank them all, and I'd like to thank you for joining, and like to thank Anthony and others for organizing this session. I think that is it. We have time. Thanks, everyone. Please follow up individually with the speakers. Anthony, do you want to say anything at the end?
No, nothing from me. Thank you, everyone.
Thanks, everyone. Great session.
Thank you.
Learned a lot. Thank you.